So 50%.
Yeah, that's a massive number.
It really is. 50% of postpartum women experience some form of structural pelvic floor breakdown. I mean, we were talking about severe laxity, stress, urinary incontinence, silent pain, and just a really profound loss of tissue integrity.
Right, and that is half of all women who have had a baby.
Exactly. Yet historically, the medical options presented to you have been starkly limited. It's like either diligently do your Kegel exercises and just kind of hope for the best, or undergo invasive surgery to implant synthetic mesh.
Which is wild. It has been a historically underserved area of medicine, totally. It's often just brushed off as, a normal part of aging or motherhood.
Right, like you just have to deal with it.
Exactly, which leaves millions of women simply suffering in silence.
Well, today's stack of sources takes us straight into a rapidly growing, somewhat controversial, but highly fascinating middle ground. We're looking at non-surgical energy-based devices.
Yeah, the EBDs.
Right. And if you are looking at these treatments, the physiology tells us you really have to look past the med spa marketing and understand the actual tissue mechanics.
Oh, absolutely. The marketing can be very misleading.
So our mission for this deep dive is to unpack the core differences between the two major technologies battling it out in this space. We've got radiofrequency, or RF, and high-intensity focused ultrasound, known as HIFU.
The big two.
Yeah. How do they actually work? Like, specifically, how does ultrasound vaginal tightening differ from RF on a structural level? And what happens when you strip away those glossy ads and just look at the clinical data? Okay, let's unpack this.
Well, to understand how these devices remodel tissue, we really have to look at how the tissue fails in the first place, right?
Yeah, the root cause.
Exactly. Whether it is the immense physical trauma of childbirth, or the steady decline of estrogen during the menopause transition, or even just the natural aging process.
Yeah.
The fundamental issue is the degradation of collagen and elastin.
The building blocks.
Right. These proteins are literally the biological scaffolding of the vaginal wall and the entire pelvic floor.
So it is less like a stretched out rubber band and more like, I don't know, like the structural scaffolding of a building that's just slowly rusting and buckling.
That is a perfect analogy, yeah. The collagen triple helix literally unspools. The foundational support gives way and the tissues lose their tensile strength.
And that leads to the feeling of laxity.
Yes, laxity, the drop in natural lubrication, and the inability of the urethra to stay closed under pressure.
Which is where energy-based devices enter the picture.
Right. And despite using completely different types of physics, I mean, electricity versus sound, RF, and HIFU actually share the exact same physiological objective.
Which is heat.
Right. Exactly. They introduce controlled thermal energy to force a massive healing cascade. Heat is the universal trigger here.
So by applying highly specific temperatures to that failing scaffolding, you can actually break the intramolecular hydrogen bonds that are holding those weakened collagen fibers together.
Yeah, it's fascinating. The triple helix structure of the collagen denatures, it physically folds, shortens, and thickens almost immediately.
Like shrinking a wool sweater in a hot wash.
Yes, exactly like that. And that provides a mechanical tightening effect right away. But, the most crucial phase is what the body does in response to that heat over the next 3 to 6 months.
Because the body sees the heat as damage.
Right. The heat essentially acts as a controlled micro-injury. The body perceives this thermal stress and rushes cytokines and growth factors to the area.
It kicks the fibroblasts into absolute overdrive.
Totally. Those fibroblasts start aggressively manufacturing brand new type 3 collagen, which eventually matures into stronger type I collagen.
Neocollagenesis.
Exactly. And simultaneously, you get neoelastogenesis, so the creation of new elastin and an increase in localized angiogenesis, meaning the formation of new blood vessels.
And more blood flow translates to better nutrient delivery, which I imagine directly combats the dryness and atrophy associated with menopause.
It does. So the biological goal is identical for both technologies. Heat the tissue, shrink the old scaffolding, and trick the body into building new support structures.
But if the goal is the same, the engineering behind how we achieve that goal is where these two technologies diverge radically.
Oh, massively.
So let's look at radiofrequency first. RF uses a high-frequency alternating electrical current.
Right. And as that electrical current travels through the vaginal mucosa, the tissue itself naturally resists the flow of electricity.
It pushes back.
Exactly. And that physical resistance is what generates broad volumetric heat. It acts very much like the heating element in a toaster, but using the body's own impedance to generate the warmth.
Okay, but wait. Passing an active electrical current directly through delicate vaginal mucosa sounds like an immediate recipe for severe surface burns.
It does sound sketchy at first.
Right. Like, how is this actually applied safely
Yeah.
without just causing massive thermal damage to the outermost layer of tissue?
Well, the engineering workaround for that is actually quite brilliant. The major RF devices, like the VVIV system that was highlighted in the sources, they employ something called a cryogen-cooled monopolar radiofrequency tip.
That is a mouthful.
It is, yeah.
Mhm.
But basically, while the RF energy is driving into the subepithelial layers, the actual tip of the wand resting against the tissue is simultaneously spraying a cooling cryogen onto the surface.
Oh, wow. So it is flash freezing the surface while cooking the layers underneath,
That is exactly it. That combination maintains the delicate surface mucosa at a very comfortable, safe temperature, roughly 40 to 45 degrees Celsius.
which isn't bad at all.
No, patients often describe it as feeling like a hot stone massage.
Okay, that sounds pretty relaxing, honestly.
Yeah, but meanwhile, just beneath that cooled surface, the electrical resistance is pushing the internal tissue temperatures to precisely 67 degrees Celsius.
Which is the magic number.
The absolute magic number.
Because that is the exact thermal threshold required to denature the collagen without pushing the tissue into permanent necrotic death. You get the shrinkage without the scarring.
Exactly. And we have robust clinical data backing up this specific mechanism. I mean, the VIVVE trial is a massive standout in the sources.
Yeah, because it wasn't just some small observational study.
Right. It was a large, randomized, sham-controlled trial across Canada, Italy, Spain, and Japan.
And the sham control aspect is huge here. I mean, in a space dominated by cosmetic claims, a placebo effect is incredibly common.
Oh, totally.
Having a sham group where the wand goes in, the cryogen cooling sprays, but the active electrical current is secretly turned off, that completely isolates whether the tissue is actually remodeling or if the patient is just experiencing, a temporary localized swelling from the physical interaction.
It's just really rigorous methodology, and the results reflect genuine structural change. At the 6-month mark, evaluating premenopausal women dealing with vaginal laxity after childbirth, 43.5% of the women who received the active RF treatment reported a total absence of laxity.
Wow. Compared to what, under 20% in the sham group?
Exactly. Under 20%.
That proves this isn't just a localized inflammatory response fading away after a week. That is permanent biological remodeling from a single treatment session.
It is. RF clearly works for that broad subepithelial tightening. It thickens the vaginal wall, improves surface elasticity, and restores lubrication beautifully.
But it faces a strict limitation imposed by the laws of physics, right?
Unfortunately, yes. Because it relies on electrical resistance and active surface cooling, RF energy dissipates rapidly the deeper it travels.
So it just runs out of steam.
Pretty much. It is phenomenal for the shallow mucosa, but it simply cannot reach the deep muscular layers without requiring so much electrical current that it would overwhelm the cooling mechanism and burn the patient.
Which brings us to the core of our deep dive. If RF proves we can safely remodel the surface, but the root cause of something like severe stress, urinary incontinence, sits much deeper in the fibromuscular tissue, well, electrical resistance hits a physical wall.
A very literal wall, yeah.
And that limitation is exactly why the biomedical engineers had to pivot from electricity to acoustics. Enter high-intensity focused ultrasound, or HIFU.
HIFU completely bypasses the limitations of electrical current by utilizing high-frequency sound waves.
I love the analogy in the sources for this. It perfectly illustrates this mechanism by comparing it to using a magnifying glass on a sunny day.
It's the best way to visualize it.
Right, so if you hold a magnifying glass over a dry leaf, the sunlight passes harmlessly through the glass and through the air. There is no heat generated in the space between the lens and the leaf.
None at all.
But the curvature of that lens forces all those light waves to converge perfectly onto one tiny, intensely hot focal point on the surface of the leaf, and it immediately starts to smoke.
And the HIFU transducer operates on that exact same principle, just using acoustics instead of light.
So it's firing sound waves instead of focusing sunlight.
Exactly. The device emits high-frequency sound waves that pass through the surface of the vaginal wall without generating any heat whatsoever.
So no need for the cryogen cooling sprays?
None. Because the surface tissue isn't resisting an electrical current. The sound waves are mathematically calibrated to converge at a precise millimeter-exact depth.
And when those acoustic waves collide at that focal point, the energy transformation is violent and immediate. The temperature at that microscopic dot spikes to over 65 degrees Celsius in a fraction of a second.
Right, creating a tiny thermal coagulation point, basically a microlesion, while leaving the surrounding tissue completely untouched.
Which is wild. And this is the defining answer to how ultrasound tightening differs from RF. It is the depth advantage.
100%. RF is fundamentally restricted to shallow, broad heating, but HIFU is capable of penetrating 3 millimeters, 4.5 millimeters, even up to 5 millimeters deep.
Bypassing the superficial mucosa entirely.
Exactly. It strikes the fibromuscular layer. It reaches the SMAS layer, the superficial muscular aponeurotic system.
And because HIFU reaches the SMAS layer, it is manipulating the exact same deep structural connective tissue that a surgeon physically pulls, cuts, and stitches during a surgical facelift or a surgical vaginal tightening.
It really is. And to grasp the sheer power and precision of focal acoustic heating, the sources point to guidance from NICE at the National Institute for Health and Care Excellence in the UK.
Here's where it gets really interesting.
Yeah, they actually utilize this exact same HIFU technology to treat breast fibroadenomas, which are benign breast tumors.
Wait, so they are using sound waves from outside the body to
Mhm.
induce coagulative necrosis deep inside the breast?
Yes, they literally heat and destroy the tumor cells without ever making a surgical incision, causing the mass to shrink and just be absorbed by the body over time.
That is mind-blowing. It demonstrates the profound localized impact of HIFU. You aren't just broadly warming the tissue to encourage some collagen growth. You are targeting specific structural depths to force aggressive biological remodeling.
And translating that extreme precision to the pelvic floor is where this technology gets truly revolutionary, especially for stress, urinary incontinence, or SUI.
Right, because SUI occurs when the endopelvic fascia, which is the thick connective tissue supporting the urethra, gets weak and sags.
So when you cough or jump, the downward pressure spikes, the fascia can't provide resistance, the urethra opens, and urine leaks.
And the gold standard surgical intervention for SUI is physically implanting a synthetic mesh sling underneath the mid-urethra to act as a supportive hammock.
But synthetic mesh implants have a massive, well-documented history of severe complications, erosion, and chronic pain.
Which is terrifying for patients.
Absolutely. But the simulation studies in our sources show that a transurethral HIFU device can use pinpoint precision to create a biological hammock instead of a synthetic one.
Oh, wow.
Yeah, the spatial control is remarkable. The HIFU transducer can sequentially rotate and fire these tiny focused sound waves in a specific geometric array.
So it's basically drawing a pattern of heat dots.
Exactly. It creates a matrix of tightening within the endopelvic fascia right next to the mid-urethra, actively remodeling the body's own deep tissue to mimic the support of that surgical sling.
And because it is millimeter precise, it can skip specific angles to completely avoid heating the urethra itself, or the vaginal wall, or the pubic bone.
Right. It is essentially an invisible scalpel, rebuilding the structural support of the pelvic floor.
I mean, the science is incredible, and the clinical trials show massive promise, but we have to look at the broader regulatory reality here.
We do. We can't ignore the elephant in the room.
Right, because in July 2018, the FDA issued a very explicit, very loud safety communication warning patients and healthcare providers against using energy-based devices, both RF and lasers, for quote-unquote vaginal rejuvenation.
Yeah, that made huge waves. The FDA noted that the safety and effectiveness of these devices for treating menopause symptoms, urinary incontinence, or sexual function had not been definitively established by their standards.
And they warned that serious adverse events like severe burns, scarring, and chronic pain could occur.
They did.
But I have to push back on this, though. I mean, if we just looked at the VIEVEII trial, which was a massive, multinational, sham-controlled study proving incredible efficacy and safety, isn't the FDA actually doing a disservice here?
How do you mean?
Well, by issuing such a blanket warning, aren't they scaring women away from a legitimate non-surgical solution that works? Like effectively pushing them back toward invasive mesh surgeries or just suffering in silence?
It is a vital tension to explore, for sure, but I think it's important to clarify that the FDA is not necessarily condemning the physics of radiofrequency or ultrasound.
Okay. So what are they condemning?
They are condemning the predatory landscape of off-label aesthetic marketing.
Oh, I see.
Yeah, these devices often received 510K clearance from the FDA for general tissue coagulation or general dermatology. That just means the machines are legally cleared as safe tools for surgeons to use.
Got it. But having clearance to coagulate tissue is very different from having approval to market a device as a cure for stress urinary incontinence.
Exactly the issue. Med spas and clinics took these broadly cleared tools and started aggressively marketing them for vaginal rejuvenation.
Which isn't even a real medical term, right?
No, it's a cosmetic buzzword, not a recognized medical diagnosis. The marketing promises vastly outpace the long-term, peer-reviewed clinical data required for specific gynecological indications.
So the FDA stepped in to pump the brakes.
Right. They demanded massive, multi-year clinical trials before companies could legally advertise these specific outcomes.
It represents a massive paradigm shift then. We are witnessing the transition of these treatments from being viewed as a cosmetic luxury, a vanity procedure sold in a med spa, to being recognized as legitimate, treatable structural healthcare issues that require rigorous gynecological oversight.
That paradigm shift is heavily reflected in how major medical organizations are updating their clinical guidelines today. Well, groups like the American Urogynecologic Society, they acknowledge the undeniable physiological promise of tissue remodeling devices, but they still firmly advocate for conservative treatments as the first line of defense.
Meaning pelvic floor muscle training.
Good old-fashioned Kegel exercises, exactly. Strengthening the actual musculature of the pelvic floor through targeted, consistent physical therapy remains the foundational step.
Because energy devices, whether RF or HIFU, do not strengthen muscle.
Right. They remodel the connective tissue encasing and supporting those muscles.
But the sources reveal these shouldn't be viewed as competing therapies. There's a really fascinating randomized controlled trial looking at climacteric women suffering from stress urinary incontinence.
Oh, the combination study.
Yeah. They divided the women into 3 groups, one doing solely pelvic floor muscle training, one receiving solely RF treatments, and a third group combining both therapies.
And the results are so telling. After 6 months, while all groups showed some improvement, the combination group significantly outperformed the solitary treatments in reducing urinary leakage and dramatically improving quality of life metrics.
It acts as the ultimate adjuvant therapy. I mean, think of the pelvic floor like a trampoline.
Okay, I like that visual.
If the springs holding the trampoline are stretched out and loose, you can have the strongest leg muscles in the world, but you aren't going to get a good bounce.
Because the tension is gone.
Exactly.
Hmm.
The muscle training alone isn't enough because the foundation is weak. But the RF, or HIFU treatment, physically tightens those connective springs.
That makes perfect sense.
Yeah. And once the structural integrity is restored, the muscle training becomes exponentially more effective because the muscles finally have a firm foundation to contract against.
The synergistic effect is really where the true future of pelvic floor therapy lies. Moving past the marketing hype means understanding the distinct physiological roles these tools play.
Totally. So to sum it up, RF provides broad electrical current heating. It's unparalleled for restoring surface elasticity, thickening the vaginal mucosa, and stimulating the angiogenesis necessary for natural lubrication.
And a tiny FU serves as the acoustic sniper. It bypasses the superficial layers entirely to deliver intense, pinpoint thermal coagulation deep into the structural layers, physically remodeling the fibromuscular support system.
But neither technology is a magic wand.
No, absolutely not. And they certainly do not replace surgery in cases of profound, severe organ prolapse.
Right.
But when applied with careful, individualized clinical assessment by a specialist who understands exactly which tissue layer is failing, they are incredibly powerful interventions.
Well, we hope you walk away from this deep dive feeling fundamentally equipped to navigate this space. The next time you see a flashy brochure for tissue remodeling, you now have the biological literacy to look past the buzzwords.
You can ask about depth penetration, understand the difference between broad resistance heating and focused acoustics.
And most importantly, advocate effectively for your own structural health care.
Definitely. And, as we wrap up, consider the broader implications of what this technology represents.
That's wild to think about.
It is. We are utilizing mathematically calibrated sound waves to induce coagulative necrosis and non-surgically remodeled deep collagen, effectively building a biological hammock to replace a surgically implanted synthetic mesh.
The invisible scalpel in action.
Given the rapid advancements in ultrasound imaging and focused acoustic energy, one really has to wonder, are we approaching a horizon in medicine where the traditional physical scalpel becomes largely obsolete?
Wow.
Could the precise millimeter-exact manipulation of sound and heat eventually allow us to perform complex structural repairs deep inside the human body without ever making a single incision? incision.
It certainly makes you wonder how much longer the traditional engineering mindset of physically cutting, patching, and stitching will hold up against the sheer elegance of acoustic biological remodeling. Keep questioning the physics, keep exploring the science, and we will catch you on the next deep dive.